Hey everyone, it's Dr. Ellie here with her pod, I Heal Kids. And if you don't know me, I'm in Asheville, North Carolina, and my practice is Middle Path Integrative Pediatrics. I'm a holistic pediatrician. I see kiddos 0 to 21 years old, and I do holistic peds. I also do functional medicine for kiddos 2 to 102. So if you don't know what functional medicine is, go check out my other pods. But basically, if you're burned out, you're exhausted, your gut is messed up, your hormones are off, you're gaining weight, come check me out. Hi, I'm super excited. I'm here with Dr. Erin Riley today. Welcome.
Hello, I'm glad to be here. Thank you.
Yes, I'm so excited. You guys, if you do not know Dr. Erin Riley, you really need to get to know her. She is amazing, first of all. She was born and raised in the foothills of Western North Carolina. And since 3 years old, which is crazy, she knew her purpose and it was to help other people. And she obtained a nursing scholarship, attended UNC Chapel Hill. Ooh, fancy pants. I love it.
Go
In
Heels.
pursuit of in pursuit of a nursing degree. But because of her growing knowledge of the immense intelligence of the human body, she actually shifted her direction and started helping people heal naturally, which I totally get that. After graduating UNC, she continued her studies at the largest chiropractic school in the nation, Life University, and graduated as salutatorian, which is crazy. I did not know about you. Congratulations on that.
Thank you. It was wild.
Yes, yes. And you know what? After finishing chiropractic school, she served for almost 5 years in a large family practice clinic. She gained skills, she's gained tools, knowledge, and she started the practice of her dreams in 2022. You guys, just a few months after giving birth to her daughter, which is proof there's never a right time to start a business. You just have to do it.
Ready or not.
I can attest to that. Yes,
Yep.
Ready or not. And now, Dr. Erin, you have a passion for helping individuals overcome health needs and health obstacles naturally. And this is the main reason I want to talk to her today. She's an immense love for serving pregnant moms, babies, and kids. So in order to serve these populations, she obtained her CACCP, an advanced postdoctorate certification through the International Pediatric Chiropractic Association, and is also an advanced practitioner in proficiently certified in the torque release technique, if I can get that out.
I tested your abilities on that one.
Yes. Yes. The alliteration there kind of got me, but yes. So it's an amazing way to, help kind of profoundly change your own personal health journey. And she just loves doing it for everybody in the community. And I certainly have sent many people to you for help. And I just really appreciate you taking the time.
Yeah, I'm glad to be here. Thank you.
Yeah. So first things first, we kind of covered some of your story, which was pretty wild. One day I'll have to tell my story too about how I was a vocal performance major.
Yeah, I'm going to need to hear more about that.
Yeah, it ended up here, but yours is pretty wild too. And you kind of went down a whole circuitous path to end up in the holistic world. Do you want to tell us a little more about that and what led to you kind of focusing on kids and families?
Yeah. So I would say at 3, I was like, I'm going to help people. And the way that I observed that was my grandma was living with us when I was a child, and she was dying of cancer. So we had all these nurses in our home, and it was a really profound experience because I saw how helpful the nurses were for her in that experience. And so I was like, the way you help people is you become a nurse. And so that was again, 3 years old, I'm going to be a nurse. Did all the things to get me to that point. And then I'm in college learning about the body, how amazing it is, how intelligent it is in one class, anatomy and physiology. And then in the next class, I'm memorizing drugs and antibiotics and drug reactions. And I started to feel a disconnect of okay, the body's amazing. And also, why do we need so many drugs and so many surgeries? And having these kind of personal thoughts, and at the same time, doing the college thing where you I did the college thing where I partied, stayed up late, ate just only peanut butter and jelly sandwiches and bags of chips, and pretty much burned myself out and started to get sick, and went to the campus doctor and got antibiotics. Then a few weeks later, a new thing, got antibiotics. A few weeks later, it, moved from here to here in my chest, got antibiotics. And ultimately ended up with IBS, and I played volleyball.
Oh.
And so I could not even make it through a volleyball game without well, I won't curse, but almost like pooping my pants. And
Yeah.
yeah, I couldn't like run through campus without like I had mapped out like all the bathroom stops that I would do during my training.
Oh,
So
yeah.
started to have like these personal health issues while again learning about antibiotics and antibiotic resistance. And I was like, why am I doing this?
Yeah.
And ultimately, I was like, I feel like I can heal myself without antibiotics. And it was the first kind of light bulb moment because I grew up just in the medical model of if you're sick, you take this, or if if this, then this, as far as again, essentially drugs. And so I healed
Yeah.
my gut and no longer had IBS. And I think the final straw, so all of that was happening. And then the final straw was my sister's a nurse. And I went to her nursing school graduation and I was at like a round table full of nurses and I was telling them, like, yeah, I'm about to apply. I'm going to be in UNC's nursing school. And pretty much unanimously, they were like, don't do it,
Mhm.
and they were all burnt out. My sister's graduation project was on nurse burnout. I went home that weekend and changed my major. And I was like, okay, I know I'm supposed to help people, but I don't think it's any longer feels in alignment to do it in this way. And then it
Mhm.
was a whole like floating around, like, should I do nutrition? Should I do massage? Yeah, how do you help people naturally was my next task to figure out. And
Yeah, yeah.
I had a girlfriend who knew she was going to chiropractic school. And if you met like the recruiter, you got to go to a weekend in Atlanta at Life University for free. So we were like, yeah, let's go have a weekend in Atlanta. And so I went with her to, they called it like leadership weekend. And I'm there to support her essentially, but I'm sitting in the auditorium, like listening to their message of like, this is how the human body is designed. It is really intelligent. It is very smart. And these are the reasons that it starts to break down. And these are the reasons and ways that we can support it to heal naturally. And just hearing testimonial after testimonial and seeing chiropractors who've been practicing for 40 plus years who love their job and only want to continue practicing. And I'm like, in tears, like listening. I'm like, this is it. And I'd never been adjusted, but I was like, I'm going to be a chiropractor, obviously, and applied to school
Obviously.
that weekend. And then, yeah, fast forward, like then I started getting adjusted in school and it just changed me, it changed my health. And then when I wanted to be a nurse, I was like, I'm going to take care of moms and babies. And I just have always loved that. I think that's such a powerful dynamic and such a profound way to serve families. And then when I came to chiropractic school, like day one, I found out that I could do that in chiropractic. So I was like,
Yeah.
cool. I guess I'll just do that differently. So I always say like chiropractic chose me because it was a very roundabout way that I landed in those seats, but it's amazing and I love it every day.
Yeah, it's so interesting, like, how so many of us kind of end up like I haven't well, maybe there is a story of someone just, like, naturally maybe someone who's been, like, exposed to holistic health from a young age, and they just kinda knew that's the route they wanted to take, but a lot of the people I talk to, and myself included, it's kinda like, I didn't know I grew up mostly in the well, I kind of was everywhere, but when I was in my more, like, formative years and I was trying to, like, pick, like, what I was gonna do with my life, I was, like, in Missouri, like, in a town where it was, like, there was an you could be an MD or a DO, which is an osteopath, and I was like, I guess I'll be a DO because it felt like more holistically
Yeah.
vibey or whatever. And then I graduated from all of that training and I got my first job and I was like, "What is this? Like, maybe I should have researched this more." I didn't know research like, I was like, I didn't know a doctor, there were no doctors in my family, didn't even occur to me I mean, I graduated high school when I was 16, did not even occur to me to, like, go talk to a doctor. Like, you were so
Yeah.
smart that you had that conversation with nurses because I was just like, "Oh, yeah, like, med school, that seems cool." Like, I was like and then
Yeah.
I had this conversation with my dad because the story is so common, like the burnout and all of that, and, like, a lot of people don't even know, like, I think correct me if I'm wrong if there's some specialist in this area that knows better, but I think the physician suicide rate is really high now. I think it's, like, 1 in
Mhm.
10? Is it 1 in 10? I hope not.
Well, I
Maybe
don't
it's 1 in
know the
100.
specific
It's really
rate, but
high.
it's
Yeah,
too
it's
high.
super
We can
high.
agree on
It's
that.
too high. Yeah, 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 it's too high. And I call my dad up and I'm like, "Okay, I have to see a patient every 15 minutes. I can't pee. I can't eat." The 15 minutes becomes 7 minutes after the medical assistant gets him in the room. I'm having, like, panic attacks. My dad's like, "Well, obviously they just want you to leave a prescription pad of amoxicillin prescriptions just signed and left on the desk, so then you don't have to do anything. I was like, "Oh my gosh, he's
Mm,
right. That is what they want. That's what they want me to do. They don't want me to talk about breastfeeding. They don't want me to talk about how you can heal. They just want me to, like, pass out meds." I was like, "This is
yeah.
awful." And so then I had to go do my integrative work, and then from there I had that personal journey with, like, getting celiac, which at least I wasn't having the diarrhea, but I was having some towards the when I finally got
Yeah.
diagnosed, but I was, like, having panic attacks and, like, just felt really sick, and it was a weird journey.
Yeah, it's weird that when you're in the model that you feel like you should be in, where you're like helping others, and then you can't even help yourself with that own model. I was like, why would
Mhm.
I prescribe people these medicines when they're like actually ruining my gut and my health? Yeah. So finding a model that, supports that healing process more efficiently. And there's obviously a time and a place for medicine, but I think to your point, it's just we just way overprescribe for
Yeah.
everything essentially. So it sounds like you had
Yeah.
a great roundabout way too of landing where you are.
Oh, yeah, yeah, yeah. I mean, it's definitely, like, a journey. I feel like I wanna hear more about chiropractic, though, because like, I feel that and I think I have had felt like this when I was growing up, because I didn't really know what a chiropractor was, to be honest. I kinda was just like, "Oh, yeah, that's, like, where you go when you have back pain, people, like, pop your back, and then you're better, and then you leave, and then, like, that's it." But now I know a lot better. Do you
Yeah.
wanna just kinda tell us, like, what truly is
Mhm.
chiropractic care? Like, how is it? Because I know that it's focused more on the nervous system, if I'm not wrong. So do you wanna talk
Yeah.
about that and, like, why that's important for kids and everything?
Yeah, let's do that. And I did lie earlier because I actually had been adjusted one time before I started chiropractic school when I was a teenager and I had like hurt myself playing volleyball. And so my dad took me to his chiropractor and I thought this guy was crazy. Because he didn't explain anything. He ultimately said a bunch of letters and numbers, which now I know what he was saying as far as like my specific listing or vertebra and like how it was misaligned. But then the table like popped up and dropped down and then he was like, okay, I was like, chiropractors are weird. And that was like my only experience of chiropractic before school. And so there are a lot of like misconceptions, and it's hard under the chiropractic umbrella because there's almost like 200 different techniques. So it can look so
Wow.
different. Like, and in Asheville, there's a lot of chiropractors. So you could go to that one every single day and have a totally different experience every single day. So under the chiropractic umbrella, there's a tonal model, and there's a structural model. So structural is like where typically like you go, you get x-rays and they're measuring your alignment and they're adjusting to improve posture and or pain specifically. And then the tonal model is like more of what I practice. So it's specific to the tone of the nervous system. And in 1895, like when chiropractic was founded, that was like the model that was intended. They noticed that with adjustments, not only people changed physically, but also mentally and emotionally. And so really like the major premise of chiropractic is if there is stress or dysfunction within the nervous system, it impacts your brain's ability to understand your body or to communicate to the body. And it impacts your body's ability to send appropriate information that the brain needs to regulate, because that's what it does everything. It's like the master controller or command center. So there's ultimately like a huge disconnect in the system. And over time, that leads to dysfunction. And then if you leave it long enough, then it leads to what we call dis-ease, which then like turns into signs and symptoms. Chiropractic doesn't
Mhm.
necessarily treat a specific sign or symptom, but we work backwards to address the dysfunction in the nervous system or where there may be a specific area that is stuck or not moving or not able to send appropriate information to the brain. We do very specific gentle adjustments to like restore. And then from there, the body can better regulate and heal and function. So then we see lots of different signs and symptoms change. So it is a very different model than, I would say, like, old school or, like, a lot of traditional chiropractors in town, and
Mhm.
it's definitely effective for neck pain and back pain or headaches, which is, like, probably the 3 most common things that people would automatically think chiropractic is great for, and that's where a lot of the original research was done because it's kind of easy it's easier to research those things than like probably anxiety or depression or,
Mhm.
IBS or Crohn's. But a lot of the research is actually changing that is proving the adjustment is impacting the brain. And then the brain is what is controlling and making everything else kind of fall in line or start to heal differently. So it's super exciting being in the tonal model because that's a lot of where the conversation is shifting. And I think, the
Yeah.
vagus nerve is becoming a lot more popular and trendy. And so a lot of the conversations are changing to the nervous system. And us chiropractors over here, like, yeah, we've been talking about
Yeah.
that. And that's like truly our only focus is really making sure the brain and the body are talking to each other with ease and there's no roadblocks in
Yeah.
place.
Yeah, it's taken me a while to kinda understand that because I actually what did I see a chiropractor for? I think I was probably having some body pain or something, like, in my 20s or 30s. I was running a lot at the time. Anyway, I saw this guy and he was, like, trying to explain to me about the nervous system. I really couldn't understand what he was saying because I think I was so fixated on, like, what am I trying to say? Like a nervous system disease, like something like
Got it.
mess or something like that. And I was like, what is he trying to say about the nervous system communicating? But now to your point, what is super interesting is I've actually landed in putting the nervous system first as well. And that's
Hmm.
been a bit of a process for me. I look at it obviously through a different lens than you do, or maybe not obviously, but I do functional medicine, right? And so a lot of times there's a lot of chatter about healing kids' guts, and that is super, super important. That said, what I'm finding in my work is that we have to really work on the nervous system first, or the body really cannot heal the gut. And a lot of people are really thrown by that because they're like, well, why do you want to do 2 months of adrenal stuff? So, okay, let me talk about this. So, the
Hmm.
adrenal glands live above the kidneys, and basically the brain talks to them through the pituitary glands. So it's brain, pituitary, adrenals, and then those glands produce chemicals like adrenaline, noradrenaline, and cortisol. And that's fine if you're running away from a bear and you're trying not to die. Okay. It's
Serves a
not
purpose.
fine. Yes. Not fine if like every day of your life you're running on adrenaline and cortisol. Like that's a recipe for like serious health dysfunction. And unfortunately, in this world, because it is like kind of a scary place to live in right now. Let's be honest. There's a lot of like stuff. Most of us are living in that place and then the body dysfunctions. And why does it dysfunction? Well, in this model, it's like the cortisol is really high. What does that do? It suppresses the immune system. So now we're getting hidden infections. And where do the hidden infections go? It's usually the gut. So if we don't kind of fix this other part first, it's really hard to heal the gut. And what does the gut affect? Everything else, right? So it's like inflammation in the brain, inflammation in the rest of your body, the detox pathways, all of that. So it's sort of interesting that I think that things are kind of converging in that way. And I would never say, and I don't think you're saying this either, I'm not saying like there's never a moment for acute intervention, for sure. Like if you're in like, heaven forbid, like a motor vehicle accident and you need EMS services or, like that's where I think Western medicine is really, really good.
Yeah, I totally agree.
Maybe not so good at like some of the chronic inflammation stress disorders, like where we're getting sick from just like living in the world. Um, yeah, I love that I guess I love that the 2 frameworks are so synergistic and work so well together.
Yeah, I
Do you wanna
agree.
just, like yeah, do you wanna just, like, walk us through, like, what happens in a pediatric adjustment? Like, what can parents expect? Because I definitely have had people be like, "It looked like they weren't doing anything." So I just wanna, like, pick that apart.
Yeah, it can look so different. I love how you said you see like ages 0 to 21. We also try to see newborns as soon as possible. And the reason why is because birth is inherently stressful. And pregnancy now too. Like if you're a pregnant mom living in this world, there are a lot of stressors and ultimately this baby is inheriting mom's nervous system. So sometimes even in utero, these stress patterns can start. And then to be completely honest, we've totally tried to control birth. And so the more and more interventions that we have in birth, the more stress that puts on mom and baby. So I've honestly, like, yet to check a baby in practice, and the research supports this as well, that about 90% of babies are born with subluxation, which is like that fancy word that I was talking about earlier, which means a stuck or stored stress in the nervous system. And so as soon as possible, we want to check babies' nervous systems because all they should be doing is eating, sleeping, pooping, growing and developing. And to your point, if they're running away from a bear, their nervous system's not doing any of those things. So those are really
Mhm.
common reasons that we see babies is one to just support healing post-birth, kind of no matter what birth
Mhm.
looks like, and then to make sure eating, sleeping, pooping, free of interference. And with a baby, we do, well, really with anyone in our practice, we start with a set of nervous system scans. So we have two different scans that we do. Both are non-invasive, but it helps us gather information from the nervous system. Because when we talk about the nervous system, to your point, like a lot of people don't even know what that means, but it's the brain, the spinal cord, and then we have trillions of nerves that go to every single cell, organ, tissue, muscle. And we feel about 8 to 10% of those. So like you and I maybe have a conscious awareness of like how our feeling nerves are, but like a baby can't tell us it. So we do scans to get the full picture of what does stress look like in their nervous system, to what extent is it there, in what regions is it, and maybe how is this impacting their ability to eat, sleep, and poop. So they're in their
Hmm.
little diaper and we roll it's a high powered thermometer. So we roll the little thermometer up their back. We get a printout, shows me exactly where there's nervous system dysfunction, and then I do their adjustment. And the adjustment is I use about the amount of pressure you would use to check if an avocado is ripe. So it's really is gentle, and I'm looking for tone. I'm looking for tone. How does their body move? How does it not like to move? Where is there stuck or stored tension? And then oftentimes I'm just using a finger and doing slight vibration or helping kind of release fascial restrictions and working with their system to find more of a state of ease. So that's what it looks like when it's a newborn. Toddler, totally different. We're like rolling around on the ground together.
Yes.
Maybe mom is holding them while they get their scans. Sometimes, like, we try to not create a negative association with our practice
Yeah.
because a lot of toddlers, especially, don't enjoy going to the doctor. So
Yes.
we make it fun and exciting and have games and toys, and they may not ever lay on my table. I have a playroom, so I do a lot of adjustments in the playroom. So again, it can be super gentle. Something called an integrator, which is this handheld tool, and everyone just calls it the clicker
Okay.
because it clicks. So it puts a specific force and frequency into the nervous system that allows, again, the brain to be like, oh my gosh, I should pay attention to this space. And like, I didn't even know that I was holding tension there. And just again, allowing that reconnection to take place. So kids love it. We sell little like kid versions of the clicker and they take it home and they adjust all their stuffed animals and stuff. So it totally depends. Like honestly, my daughter's the hardest person to adjust right now. She'll be 3 in December. And she's like, I don't want a clicker. I don't want to do any hops. Like she tells me exactly how she wants to be adjusted. So she says,
Okay.
adjust me like a baby. And so she'll lay in these little pillows that we have for babies. And then I just, gently adjust her. Some kids, like, yeah, they just climb right on the table and they love it. We take care of a lot of kids on the spectrum or with sensory needs. And so, like, every single adjustment and interaction looks so differently, but catering specifically the type of adjustment to that nervous system's needs is so important. And that's why we do scans and we do them regularly throughout care because some kids do need a lot more care. Some kids need less care. Some kids need more input. Some kids need less, just depending on like, hey, is their nervous system totally, we call it raging bull. Like, is it so activated and hardwired, or a gas pedal is another term that we use for that? Or have they been in that state for long enough that they're totally depleted or shut down or freeze, right? And so the adjustments look different depending on, again, their needs. So it's definitely not a one size fits all. And I think some parents hesitate because they're like, my child will probably not
Yeah.
let her touch them, or they will not sit still long enough for an adjustment. And it's like, I honestly should just wear knee pads because I crawl around the office more than anything else. So, so we meet kids where they're at and make it really fun and exciting. And for the most part, kids ask their parents to come here, and that's the coolest part too, because they, if they didn't sleep well at night, or if they have a tummy ache, or whatever it is, they're like, hey, can we go see Dr. Erin? And that's like really when It's cool because how powerful to like have an understanding of things that support your system as a
Yeah.
child. Because again, I didn't get to learn that until my 20s. So
Yeah.
yeah, long answer short, it looks very different and it's super fun and very powerful because when a nervous system can focus on brake pedal activities, that's what we call them, rest, digest, feed, breed, growth, restoration, detoxification, healing can take place. And when it can't do that, that's when we see a lot of kids who struggle.
Yeah. Me too, and I love that you're on the floor because that's where I live too. I can't remember the last time I put a kid on my exam table unless they wanted to go there,
Uh-huh.
for whatever reason, or like a teenager who's like, hopping up or whatever.
Yeah.
Hey guys, are you a new parent wondering, when do I start peanut butter? What about eggs? Gluten? I don't know. It can feel really scary. And evidence shows that early introduction of allergenic food can actually prevent allergies. But how and when matters. And I'm going to walk you guys through it step by step through my course. So skip the guesswork, learn exactly what to do in my Nourish with Confidence class, and sign up today. Link in bio. Quick question, the thermometer, is that like what, how does that work? Is it like an
Mhm.
elevated temperature kind of indicates like an area of that you need to work on, or like how does that, can you
Yeah.
tell us more?
Yeah. So they're called insight scans, and it was technology that NASA originally developed, and then it's been modified and adapted for chiropractors to use in practice. And originally, I was looking at like the effects of gravity or anti gravity on astronauts' nervous systems. And again, we've been like adapting it to be like, hey, how much energy does it take us to exist here on planet Earth? But the one I
Okay.
use specific to newborns, until kids are weight bearing, we only do the thermal scan. And so it's looking specifically at temperature along the spinal root, like the nerve canals. So we put right along the spinal cord and measure temperature. And the first scan is temperature differentials. So how different is the right side from the left? Because when we think of all the things the nervous system should do, one of the things is temperature regulation. So if we're seeing dysregulation, it's like right there. That's a part of the nervous system that can't do its job. And
Okay.
then there's a second scan that I also look at that presents what the temperature was at each segment. So then I'm seeing the dysfunction. This area needs support. And then I can see, is it because it's too inflamed? There's too much heat, or is it totally shut down or turned off to the point it's not getting
Okay.
blood flow, essentially, nutrient support input. So it's, yeah, kind of a stepwise process to see where is there stress and then how is this stress impacting the nervous system? Is it too gas pedally, heightened, warm, or that more freeze, cooling, shutdown?
Oh, that's fascinating. I feel like there's so many things that might correlate to, like from acute injury to like medical disorders, like
Hmm.
degenerative disc stuff. I'm just kind of like, now I'm like, I feel like I've been opened up to a whole new world of diagnosis. I'm like, whoa, I've got to come out and get myself scanned. I'm going to
Please.
make an appointment. Yes.
It's so informative. And oftentimes, like the thing I love the most is it's really validating to people's experiences too, because we tend to catch a lot of people who've been through the ringer. They've done all the doctors, all the things, and they've been dismissed. And then they come here and we're like, no, you literally have stress here, 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 and
Yeah.
here. And these are all the different functions that that's affecting in your system. And these are all the different ways that that can look. And we've checked all these boxes. And it's really like a cut and dry correlation to the where they're like, yeah, that's exactly how I've been feeling and what I've been noticing in my
Yeah.
system. And so the scans are often validating to our experience too. Because if I tell somebody like, hey, I'm actually seeing chronic stress in your system to where your nervous system's totally crashed out, it's really depleted, and they're like, yep, I've been in a toxic relationship for 30 years. So like, yeah, there are a lot
Mhm.
of different types of stressors or dysregulations, dysfunctions that can affect the scans. And so that's part of that first visit too, is like we do a pretty big deep dive. What's your life story essentially? And then we correlate it to the scan of like, oh, you've had 5 concussions. No wonder your C1 and C2 are trash, or
Yeah.
you have
Yeah.
chronic asthma, like your thoracic spine is really needing attention, and the, connecting the dots between the person's story and all the things that got them to this place and like how their nervous system is trying to hold on to that story too.
Yeah, it's interesting because I totally get the validation part because like this is kind of like what happens when I do people's adrenals. And people are like, "Well, I went to the doctor, they said everything's fine, and but I'm exhausted. Like, I can barely get out of bed, I can't take care of my kids, like, I'm doing my best, but, like, I can take care of them, but it's not, like, to the level that I want to?" And then we do their adrenals, there's 4 levels of adrenal fatigue, and they'll be, like, stage 3.5, and I'm like, "It's amazing that you made it here." Like
Yeah.
like, like, this is not, in your quote, in your head or, like, whatever that I don't even know what that means, honestly, because like, isn't everything in our head? But anyway, I'm just like, "We're all connected." Like, this is like, here's our neck. I don't know. Anyway.
Yeah. I love that you take the full body approach too, because I think that's also a place that medicine, traditional medicine like really misses is like there's a kidney doctor and there's a thyroid doctor and there's like, you know, there's all these doctors for different systems. And it's like, all these systems work together? And they're all controlled via the
Yeah.
nervous system. So like it's
Yeah.
you can't just treat one part of the body because everything else around it is affected or working together in unison.
Yeah. Yeah, it's so interesting. I don't know where I guess it just came from, like, 1950s science, which, like, to eat there's goods and bads of everything, but, like, maybe it was just, like, that fixation on, like, picking out one piece and just testing one piece at a time or whatever
Yeah.
for those of us who are, like, in the research fields. Okay, so I wanna just touch on because everyone's dying to know, like, what should they bring their kid to you for? Because we've said, okay, it's not just the back and the neck pain, so and I know there's a lot of things I refer to you for, but
Yeah.
let's just hear from you. When should we see you?
Great question. If your baby was born, I would like to start there. And moms know if birth was stressful because they went through it, right? So if truly there's any intervention in birth where babies have to be assisted earthside, they use the most vital, important part in the nervous system to get babies here. So the upper cervical spine specifically. So especially like vacuum extraction, Pitocin contractions, it's all compression forces. Cesarean, there's specific patterns of stress that we see in babies. So birth is a great reason to get babies checked. Oftentimes, those things can look like certain signs and symptoms. And I mentioned it earlier as far as eating, sleeping, pooping, but I do work with a lot of lactation consultants to support nursing. Typically, there is a breast preference if there's upper cervical tension. And this is also the area that is controlling and coordinating eyes, ears, nose, throat, TMJ, tongue, lips. So there's like a million coordination factors that have to happen for babies to successfully latch, suck, swallow. And if there's stress in the part of their nervous system that's coordinating that, there can look like dysfunction. So nursing challenges and then colic and reflux, that is a gas pedal nervous system.
Mm, mhm.
Period. And so that's a huge reason that we see newborns. I also think that has gotten so normalized, and that's a big conversation we have in practice of like there's a huge difference between common and normal. And it is very common for babies to have reflux, again, because everyone's stressed. And birth sucks right now. But it's not normal. So colic reflex is a great reason as well. And then oftentimes the families will bring me kids so I can push their poop button or sleep button. So there are
Okay.
certain adjustments that, again, are very calming to the nervous system. And ultimately that allows them to find that state of ease more readily. So sleeping and pooping tend to be our biggest side effect of baby adjustments. Again, constipation has gotten totally normalized of like, oh, my
Oof,
pediatrician
let me
told
tell you. Let
yeah.
me tell you
It's
about that.
apparently nowadays it's like so normal to not poop for 3 or 4 days, and I'm like, you would feel
Uh,
like crap if you didn't, literally, if you didn't poop for 3 or 4 days. So those are like all the most common reasons we see newborns. And then what I really want parents to know is kids don't often grow out of stuff, they grow into it. So if that baby
mhm.
starts with subluxation, nervous system stress, gas pedal orientation, and then they're a toddler, that's when FRAP hits the fan, right? Or it can, right? And so then we see like immune dysfunction or recurrent ear infections, or they are waking up 4 or 5 times a night. Obviously, there's a lot of big emotions in toddlers, and there's like a normal part of development that is like they're feeling into that. And there's also dysregulation. So
Mhm.
And then, we're following that kid, and as they get into school, then they can't sit still or then they can't focus. And then we see like attention deficit or more behavioral challenges or again, sensory processing. And it just follows the kid in different stages of development and their nervous system is massively exploding. So then what started as latching problems can then turn itself into a whole host of things down the road. So the earlier the better. Like that's an amazing
Mhm.
part of chiropractic is it's so preventative and proactive. So honestly, the vast majority of kids that I take care of in my practice are well kids. And like they don't have anything that we're talking about. And that's the point is like, hey, let's
Mhm.
keep them that way. And then
Yeah.
obviously I have a lot of families who are looking for answers or solutions. And then that's how they find themselves in our office too.
Yeah. Thank you for that language of they don't grow out of it, they grow into it, because that's actually something I talk about, but I haven't been able to find a way to say that effectively. But it's so true. It's so true. And sometimes it's difficult, I think, to wrap one's brain around the fact that, like, well, they seem fine. Like, maybe it's just like a phase or, they're a toddler. Like, of course they're X, Y, and Z or whatever it may be. And sometimes I find that, like, and I don't know, maybe it's just human nature. Like, we don't want our kids to have issues or, like, we're hoping for the best or whatever it may be. And not that there is maybe a major issue or not, but I do see that the body wires towards a certain way. Kinda like if y'all are like meditators, if there's any meditators out there or people that do other spiritual practice like prayer or contemplative practices, like, how your brain kinda wires towards like, "Oh, like, I can actually regulate right now because I just did my, like, 20-minute meditation." I feel like that happens with the physical body as well. Like, it's almost
Yeah.
like you see a hint of something and then it can just kind of root itself or, like, plant a seed and then become like this big thing that maybe it
Hmm.
didn't need to be. Like, I think about this, like, just even like maybe a simple example just to make it more tangible, it would be like speech. Okay, so like let's say I'm starting to notice like there's this speech, like an expressive language delay. Like maybe we're just having a little bit of a harder time getting those first few words, or now it's 18 months and we're not saying much. And sometimes people just kind of wanna wait on it, but I found that in general, it's better to do something sooner because then we can kinda nip it in the bud
Yeah.
versus kind of letting it linger, and then, if you do let it linger, what I've seen anyway, at least from my experience, is like, okay, the speech, expressive language, then it runs into pre-reading, and then pre-reading runs into writing, and writing runs into school stuff, and then we've got anxiety layered on top because
Yeah.
now I've got educational differences or learning differences. And like, I think that's what you're talking about when you say that. And I think that's important for people to know because sometimes it's like, well, because this is an objection I get to my practice sometimes is like, well, we don't need the doctor that much. We don't go to the doctor that much. And I'm sort of like, well, why not? Like, come on, because we need to get your baby's care optimized. Like, the point's not to come, like, don't just come and see me. I mean, do come and see me when your kid's sick too,
Yeah.
but don't just come and see me when your kid is sick because I want to make sure that we can make sure your child is not sick as much as possible. And I think that's a difficult concept to wrap your brain around. And maybe that's the
Yeah.
same for your
It's
practice.
a paradigm shift because our society is so reactive
Yeah.
that that is like where most people's brains are of like, oh, I'll go there if this happens. And I think it sounds the same for your practice too, of like, no, we want to see all the healthy kids and all the healthy babies and all the healthy families to support their health and vitality and to keep them that way. Because different seasons of life have different demands and different stressors too. So if you're building, and that's a lot of what we talk about, especially with our wellness families, is it's all neuroplasticity and it's all muscle memory. It's literally the same thing that if you were to go to the gym what never versus like, 3 or 4 times a week. Those are
Yeah.
different muscle memories. So we do adjust families even in times of ease so that when stress occurs, they have the resiliency and nervous system flexibility to adapt better. And we talk about like that's the bottom line is how adaptable is that person because physical, chemical, emotional stress, that's not the problem. That's not what causes dysfunction. It's your body's inability to adapt to physical, chemical, emotional stress. So it's like the adaptability piece that a lot of we're supporting families in, whether they have signs or symptoms or not. It's like, let's support you and prepare you for the next phase or season or whatever that may be, so that you
Mhm.
have that built-in muscle tone and flexibility to handle life's curveballs like a rock star, because Lord
Yes.
knows they come.
Yes, that's right. Well, we just have a couple minutes left, but I wanted to ask you 2 questions. 1, what is, like, the biggest misconceptions you hear, and, like, how can you reassure families about that? And 2, where can people find you?
Yeah. I think, well, I will say this, like, I would not take my child to any chiropractor. There is definitely a difference in, and, you can attest to this, of like specializing and training and knowing how to support children. And there are some chiropractors out there that are like, oh, it's just a small spine. And it's like, no,
Right. No.
it's a totally different ballgame. So if you find a pediatric trained chiropractor, very safe and very effective. And those are probably the two most common misconceptions of like, oh, I've tried chiropractic, but it's like, did you go once to somebody who knew what they were doing? Or
Yeah.
did you follow care recommendations based off of that, nervous system needs? Because those are also different experiences too. So it's safe, it's effective. I have a specific certification through PX. And so it stands for Pediatric Experience. So if families like who are listening don't live in Asheville and can't come see me, you can go to pxdocs.com, and there's a whole database of chiropractors who have specific training to support families and take the nervous system approach. And there's a ton of resources on there of like, though this is all founded in science too. There's research and articles and like I talked about, like the brain model of chiropractic and lots of goodies on that platform. And then our specific platform that we are most active on is our Instagram, and it's Temple Chiropractic. And we do post a lot of educational material on there, as well as testimonials and families' stories. So there's lots of goodies and takeaways on there as well.
Yeah, and if you haven't signed up to Dr. Erin's Instagram, you should totally do it because it really is amazing. I'm on there all the time and I'm always seeing what you guys are posting. It's really, really good.
Thank
So
you.
go there and go get chiropractic care for your babies, for yourself, for all the things. And Erin, thank you so much. Like, it's been so
Yeah.
informative. You're so great. You're so educated. Your expertise is so needed. Like, we appreciate you so much
Yeah.
for everything
Right
that you
back at
do.
you. Yeah. Thank you.
Yeah. You're
And I look forward to
welcome.
our walk soon. We'll go on a walk and talk more.
Yay! Just a reminder to go and take time for yourself with your friends. Okay? It's not selfish.
Exactly.
All right, guys. Wishing you well, and we'll talk next time. If you don't know me, I'm Dr. Ellie. My practice is Middle Path Integrative Pediatrics, and I'm in Asheville, North Carolina. And go see Dr. Erin too. Okay, bye, guys.